Hello, everyone, and welcome to our webinar this evening. My name is Janie Budnick, and I am on the board of directors for the Professional Animal Care Certification Council, or PACC. We are hosting this webinar tonight, and this is really a neat one. It is very cross pet industry. So I know this evening we have some veterinarians, we have dog walkers and pet sitters, we have boarding and daycare. So great representation, because I guess you could say we kind of all have a dog in the fight when we are talking about toxin trends and how understanding new things that have come in the pet poison hotline can really help us in our own practice and our own daily work. So I am very excited that you have decided to join us this evening or are watching the replay. Wanted to give you a little information about the Professional Animal Care Certification Council if you are not familiar. So we are the industry's only third-party certification for pet care standards. And our mission here is bringing, of course, that independent testing and certification to the entire industry. Now, those of you that might not understand, what's the difference between what is independent certification, can't you be certified anywhere? Well, there are a lot of certifications out there, but the majority of them, they are going to be educating you with the information you need to know, and then you are tested on that information. That would be considered your second party certification. In PACC's situation, we are there to really bridge the gap between the knowledge and actually who you are and how you represent yourself in the community and creating standards for the pet care industry. So with our certification, we're not educators. We are an independent testing body for you to prove your knowledge of what you know in the industry. Now, whenever you pass, of course, this certification, which is quite an exam, I have to say I'm a registered nurse also, and this made me sweat just like that one did. You do receive a 3-year certification when you are certified for that. Now, there are actually 3 different levels to certification that we have. We have, of course, the certified, the professional pet care operator, we have a manager, and we also have provider. So I've believed so much in this organization. I have my certifications as an operator and a provider both. But we do have some very set core values, of course, humane pet care, very focused on animal welfare. And again, we have a very stringent code of ethics that we do expect everyone, even when already certified, to abide by. So this is very important, and we do live by all of this. So as I mentioned, we have those 3 different certification levels that are available. They each have their different requirements, which you can find some more information about that on the PACC website. So I mentioned a little bit about, of course, why you would want to look at a third-party style of certification. So this is definitely going to really measure you against a set of standards in the marketplace and really make sure that your employees, your entire team, and your community knows that you stand behind, of course, your standards of care. So if you really look at a lot of industries out there, they do require some sort of independent certification. We are actually one of the rare industries from the actual care aspect that things are a bit willy-nilly sometimes. There are so many different providers out there of pet care, and there are no standards. So what we are trying to do is really elevate the entire industry and have a standard that can be compared to. So this will really help you in your market when you're able to put on, let's say, the door of your boarding and daycare facility that you are PACC certified, that you have employees that are PACC certified. It will absolutely set you apart from the other providers in your area. So it definitely is going to build more trust with pet parents in your community. And as I mentioned, you can, of course, get your employees also certified, which talk about really encouraging them and building their own confidence in the knowledge that they have achieved through their own career with you. We do have one exam date left. So this one is the times that you can actually take the test are between November 9th and 23rd. The registration deadline is on October the 13th. Now, we do have a wonderful group online that you can go and you can join in with some people and study for that. You can find out more information, of course, on our website. You get registered on our website and ask any questions of the group out there. So I really, really appreciate this opportunity to bring Renee to you. We have Renee Schmid with us tonight, and she is going to be presenting our year in review, the Pet Poison Helpline Toxin Trends. So let me bring Renee up here. Hello there.
Hi.
Welcome,
Hi,
welcome.
everybody. Hi.
Yes,
Thank you so
thank
much,
you for
Jamie.
joining us. Why don't you go ahead and introduce yourself to everyone?
Yeah, I'd be happy to. I'm Dr. Renee Schmid. I'm a veterinary toxicologist. I am the director of veterinary medicine for Pet Poison Helpline. I have been in the animal industry for 40 some years. I started in a clinic when I was in high school and kind of worked my up through that and stayed while I was in an undergraduate in veterinary school. I'm a graduate of Kansas State Veterinary Medicine. I've been with Pet Poison Helpline for 11 years now. And before joining this company, I was in private general practice, emergency work. I was in academia, helped with a low-cost spay-neuter clinic as well. I've done relief work. I kind of had my hands in a little bit of everything in veterinary medicine, and really kind of ended up finding my passion in toxicology. So I'm excited to talk with you guys today a little bit more about it.
Yes, that is incredible. So for everyone that is over here, I see, oh my goodness, there are so many comments already. I had to go in and find out where everybody's joining us from. So we've got Canada, Florida, California. Thanks to Stephanie, we're international. I love that. Georgia, Jersey Shore, Washington. Got a lot of people in here. So I am very excited to have this go. I'm going to of course, my job is to kind of run interference for Renee. So go ahead and post your questions in here in the comments. I will be watching those, and then we will get to a bit of a Q&A part, and we can bring those questions forward. All right. Are you ready?
I'm ready. All right. Okay. Well, guys, let's get started. I do have some quizzes throughout. I see Dr. Jen tried to spoil the fun, but I've got some quizzes throughout. And so when those pop up, please feel free to enter your answers into the comment box. It'll be interesting to see what everyone has to say. But let's just get started. So really what we're going to talk about today is we're going to talk about the common toxins and categories for calls that Pet Poison Helpline has received in 2023. So at the end of each year, we compile the list, which is why we're still talking about 2023 in June, because we won't talk about 2024 until January of next year. We'll talk about some of the species, breed, and age differences with exposure types. And I think that's really important for any of us in the animal world. So whether we're in the medical profession, whether we're in the caregiving profession or the well-being profession, as far as all the different types of areas that our pets and our animals are in. And so it's kind of nice to know what some of those differences are, because I know very well that whether or not, even if you're not in a veterinary clinic, maybe a grooming or daycare or boarding provider, pet sitting, anything like that, a lot of times those pet parents, they're looking at you as professionals, they're looking at you as the experts and knowledgeable. And so having some ideas when they're coming to you first to ask you questions is going to be really helpful for you. We'll talk about a few toxin reviews, talk about some exposures and clinical signs and treatment. Some of the treatment might be guided a little bit more towards the actual veterinary professional as far as veterinarians and technicians, but even those of you who are not in that specific field, I think will benefit from it as well. So just a real quick brief comment about Pet Poison Helpline. If you've never heard of us before, we're actually in our 20th year of business. A lot of people have said, gosh, they're really new, I've never heard them. And we're not. We're well established. We've been in Pet Poison Helpline for 20 years. Our founders have actually been in toxicology for over 40 years. Several of them were actually the founders of the Minnesota Poison Control Center many years ago. So this is nothing new to us. We are well established, knowing that in today's world, there's a lot of new companies that are coming up into medical, medical health questions and helping that digitally. It's not something that we're just getting the start of. So we're tried and true to know, we're well established in the industry. We're a 24/7 poison control center, so we never close. We're open 365 days a year. We are staffed with our veterinary experts. We're credentialed and non-credentialed veterinary technical staff, our licensed veterinarians. Many of us are board certified either in toxicology or veterinary toxicology or other areas of veterinary medicine as well. And we serve the US, we serve Canada and the Caribbean, and we certainly will take calls from anywhere. We do have people who maybe are in the military and are staffed, or they're stationed overseas, and they may call us as well. We also serve some specific teaching universities in Hong Kong. So we have an $85 US fee. So for those of you who are joining us in Canada, Stephanie, hello. And it is an $85 US fee. What's nice about that is that it does include all follow-up calls for that particular case. So if the pet parent has multiple pets in the household that were exposed, it's that one-time fee. If they need to call back or the veterinary clinic calls back numerous times, it's still just within that one-time fee. And then where we really kind of are, what I really take a lot of pride in is that not only do we help educate and assess for potential poisoning concern for that pet parent, but then we also consult with the treating veterinarian. And so that treating veterinarian can call us as often as necessary so that we can help guide them to ensure that that animal's care is going in the right direction. And when I was in practice, we saw a few things here and there as far as toxins go, but not a lot. And that's pretty common for most veterinarians. And so it isn't very reasonable to expect every veterinarian to know how to treat every single toxin. And so that's where we help to kind of fill in that gap and really serve as that partnership with that treating veterinarian to help make sure that that pet gets back home with that family as soon as possible. And our purpose, I kind of said it, it's to really provide that immediate and expert toxicology resource. And we love to do education, as I'm here with you tonight. So as we kind of kick off this toxin trends talk, one of the fun things to talk about is kind of the most frequently reported poison categories. And so we put them in big buckets and big groups to see, where are most of our calls coming from. And so we look at this as all the species combined, and we take calls on any species. Definitely dogs and cats are our most common, with dogs always topping the list, but we'll take calls with any species that there is. And you'll see on here that food products really wins, and food products make up about a third of our calls, and that includes everything with chocolate, xylitol, onions, garlic, all those things, and followed a really close second with human drugs. If you think about human drugs, my gosh, there's thousands of them, right? And so that can be just about anything that's there. Plants, rodenticides, veterinary drugs. So these are going to be veterinary pharmaceuticals, so prescription medications, insecticides, foreign objects, dietary supplements, household cleaners, and then cosmetics and personal care there at the end. But with all those things together, really make a big percentage of the calls that we receive here. I'd like to just point out something that you may be interested in going to at some point. It's called Toxin Trends, and it's something that's a little tool that we started about a year ago. It's on our website, petpoisonhelpline.com, and you can look at that little ribbon on the bottom, on the left in the middle. It says Toxin Trends, and you can click on that. And what's kind of neat is that we have two different ones. One of them is the plants, and so you can look at different plants in the area. You can Unfortunately for the Canadians, most of this is in the United States at this point, but you can we do have some information from Canada as well that's in there. But you can look at kind of the top plants that animals are exposed to in your particular region. And then you can also click on those particular plants and get kind of a list of common clinical signs or symptoms that these animals would display. And so that can be pretty helpful for you, is to maybe looking at, should I have this particular plant in my household or out in my landscaping, or maybe someone's coming to you and saying that they got into a particular plant. You can look that up, information a little bit easier. And then this is a fun one as well. It's the top toxins by state. And so you can click on a particular state and you can get information as to what the top toxins are for that particular state. You can also click on the different species that are there to see what are the top toxins for those species within that particular state, as well as in the clinical signs. All right, so let's go with a little quiz, see who's still awake with me. The highest number of calls to Pet Poison Helpline each year are for rodenticides, lilies, chocolates, or grapes and raisins? And go ahead and just throw your answers in the comments. I'm saying grapes and raisins. Someone says chocolate, lots of chocolates. All right, great. So the answer is chocolate. And again, I've been here 11 years and our number one call has been on chocolate for the last 11 years. I don't suspect that's going to end anytime soon. Big reason is, who doesn't love chocolate, right? It's in the household a lot. It smells great. It's enticing for the animals. And so they just have a lot of access to it. People will bake with it. People eat it. People send it out. And so chocolate is definitely our highest call each year. And a little bonus for that: what holiday do we receive the most chocolate calls? Is it Halloween, Christmas, Valentine's Day, or Easter? You can throw your answer in the comment. I see an Easter. Anybody else want to be brave? Halloween. Christmas, Easter, lots of Valentine's Days. Yeah, it's a tough question to answer because I would have always said Halloween. I would have guessed Halloween because I just think of candy being out more frequently with that, but it's actually Christmas. So we receive the most chocolate calls at Christmas time, and if you think about it, it's given a lot more frequently as gifts. It may be under the Christmas tree. And if anyone has an animal like my cat in this picture, where she loves to chew on anything and hide under the tree, so you can't even hide the chocolate in the back of the tree because she'll find that there too. So it's kind of interesting. We'll see, and I think we'll see this in a little bit, but we'll see definitely spikes on all these other holidays, but Christmas takes the cake. So when we think about our most frequently reported toxicants, so chocolate, as I mentioned, is number one, but look at number two, grapes and raisins. Many of you said grapes and raisins. It comes in second, but it's not even a close second, not even half the amount as chocolate. And then followed by ibuprofen, xylitol, bromethalin, which is a rodenticide or a rat and mouse bait, marijuana, onions, chives, leeks, any of those types of food products. Anticoagulant rodenticides, those were the ones we used to always think about. We'll talk about that in a little bit about, if they got into rat and mouse bait, oh, not a big deal, just give them vitamin K1. And unfortunately, that isn't the case anymore in all of these cases. Vitamin D3, the supplement vitamin D3, but we have to be concerned with cholecalciferol rodenticides. I always say that it was a marketing ploy that when people started marketing cholecalciferol rodenticides or rat and mouse baits more frequently, they decided we can't call it vitamin D3 because that's a supplement, a healthy supplement. So they decided to call it by its other name, which is cholecalciferol, but it's the same thing. A carprofen, so a veterinary drug for dogs, a non-steroidal anti-inflammatory, and then lilies, garlic, acetaminophen, and amphetamine combos. All right, so another couple of fun quizzes. The most frequently reported purebred dog, is it the Labrador Retriever, Golden Retriever, Dachshund, and Rat Terrier? So which one do you think likes to get in trouble the most? The Lab. Yeah, everyone's saying lab. Yeah, so you got it. So the most frequently reported breed is the mixed breed, but boy, that encompasses a lot of things. But the most frequently reported purebred is the lab. But golden retrievers aren't too far behind, and the golden doodles and the Labrador retrievers. And so these guys, I think that a lot of it, you think about those taller dogs, they can get up on the table, get their front paws on the table or the countertop a little bit more easily, things like that. But they're all the breeds are fairly well represented, but certainly the labs and goldens take it there. Here's that one. I call it the ECG of toxicology. And so these are just the trends over the last year of different toxins. And I pulled this one out for chocolate because I thought it was kind of fun. But you can see that on Valentine's Day, there's a spike. At Easter last year, there was a spike. If you look in October raises a little bit, but it's spread out a little bit more. And I think that might be why Halloween itself doesn't win, because it's spread out over multiple days a little bit more. But then when you look at Christmas, and Christmas, it just really spikes right there at the end. And so it really beats everything out as far as the number of calls we receive on chocolate. So when we talk about chocolate a lot with animals, most people know that chocolate is not good or safe for animals to get into. And why is that? Well, because we have theobromine and caffeine as the two main toxic components. And theobromine, it's in the class of methylxanthines, which is also a class of caffeine is in there as well. And when we think about drinking tea, caffeinated teas and things like that, those contain methylxanthines. There's a difference between what type of chocolate as to what the big concern is. So if you think about the most concerning, those are the ones that probably don't taste so good by themselves. So it's going to be your baker's chocolate, your pure cacao, or your pure chocolate, your semi-sweet, or it goes then into the semi-sweet, then into the dark chocolates, and then the milk chocolate and white chocolate, which has very, very little theobromine in there. And so the animal, depending on the size of the animal, the dose always makes the poison, right? So anything is poisonous, including water, including air. And so it's the dose or the amount that these animals get into that's problematic. So if you were to think about a 20-pound dog that got into a Hershey Kiss, probably not going to be an issue. But if you take that same 20-pound dog and it got into 100% cacao or a pure chocolate, then that could certainly be problematic. And so it really is something that has to be assessed on a patient by patient basis, and what it is specifically that they got into. Dogs certainly love chocolate. Cats aren't afraid to eat it either, but they typically get kind of overshadowed by the dogs getting into that. Usually we're going to see, if where they get into a small amount, maybe some vomiting, maybe some loose stool. We can always see pancreatitis developing regardless of the amount they get into. Sometimes the pet parent may say, gosh, they're just drinking a little bit more and they just seem to be a little bit restless. As that ingested dose becomes higher, then they can have an increase in heart rate. They can be a lot more agitated and just, more restless, kind of bouncy off the wall a little bit. And then when they ingest even more than that, they can potentially have seizures. They can have heart arrhythmias. So while a lot of times we may think, brush off some chocolate, but these animals can get really sick and symptomatic from these things. Really making sure that when you guys are having, when people are having parties and people over, or they've got, that Easter basket out, the Valentine's candy out, the Christmas gifts out, all that stuff really gets put up. And I don't even say to put it on a table or put it up on a countertop, but really put it up on a high shelf so that they can't get into that. One of the other things we have to be concerned about is what else is in that chocolate. So sometimes they're not getting just chocolate. Then edibles, or we'll talk about marijuana in a little bit. So edibles are going to be common to see some marijuana and chocolate in that. Chocolate covered macadamia nuts. Macadamia nuts are problematic. Chocolate covered espresso beans or coffee beans. And then little chocolate liquor candies or treats that you buy at the liquor store that actually have true alcohol in them. Those are certainly things that can be problematic to our pets. So one of the other things as we kind of talk about next, I always like to point out is kind of marijuana. And marijuana has slowly been making its way into the top 10. And this year it's actually, or this past year, actually made it to the number 6 slot. And it's going up in the number of frequency. I think it has a combination of legalities, so where it's legal at in different states, plus it's become a little bit more mainstream conversation. And so I think that pet parents are feeling a little bit more comfortable with admitting that their animal got into marijuana or THC, plus it's just so much more readily available as more and more states legalize its use. So if you look at our 2019 numbers compared to now, from 2019 to 2023, we had over a 430% increase in number of calls that we've received from marijuana. If you look at year over year, 2023 didn't change too much from 2022. I think there were a lot of states legalizing things in 2022. And then again, as things just became a little bit more mainstream, the calls are certainly still up very high, but they're not increasing to the level that they were compared to 2019. And if you look at the trends with that, you can look at marijuana or calls. They're fairly frequent throughout. We get a little bit of a spike around Memorial Day and sometimes in the kind of wintertime and holidays, but it's something that's fairly consistent throughout the year. All right, so the most common source of THC exposures or THC or marijuana, is it plant material, medicinal preparations, edibles, or gummies? And someone asked how the symptoms of bromethalin and anticoagulant. We'll talk about that in a second. Anybody want to give some answers, some thoughts? Plant material, medicinal preparations, edibles, or gummies? Nobody wants to admit they know the different types. It's all right. Edibles, great. Plant materials. Yeah, so it's edibles. Edibles are the most common ones. And I think if you think about it, you go to some of those dispensaries in the legalized areas now, you can get marijuana, you can get THC in brownies, cookies, gummies, lollipops, mints, all sorts of different things. So edibles have really taken over as far as the most common exposure type. Plant materials next. So don't worry if you answered that. It's still definitely there and problematic. The medical preparations or prescription medications is definitely there, but we don't see that very as commonly anymore. And then we kind of throw the other as to like, who knows, maybe it's the marijuana or the THC butter preparations when people were planning on using it for other things. Some of the things similar to chocolate we have to be worried about. So xylitol, we definitely see xylitol containing products or marijuana containing products that also contain xylitol. Xylitol is toxic to dogs and can cause a low blood sugar and potentially liver failure as well. And then chocolate we just talked about, and macadamia nuts. Macadamia nuts can cause some neurologic abnormalities. So with THC, when we think about marijuana and THC, we're really talking about that delta-9 THC, which is the psychoactive component. It really kind of produces that high. It gives that psychedelic kind of almost, that euphoria. It's certainly legal in many states now for recreational or medical use. It's usually what we think about when someone says marijuana, weed, pot, THC, what have you. And when we also compare that to CBD, cannabidiol, that doesn't have the psychoactive effects in it. So it's not intoxicating. It's legal in most states for recreational or medical use. A lot of times, places that don't have THC or marijuana legalized, you can use CBD. CBD oil gets used a lot for different, pains or inflammation. It's often marketed for pets as well. It's not FDA approved, so there's very little oversight with that, but it's something that is really being used a lot more frequently in humans and animals, has a much wider margin of safety. The downside is that when we think about CBD products, because there's very little to no regulation, is that a lot of them are contaminated with THC as well. And so if an animal gets into a CBD product, they could still potentially develop clinical signs, most likely due to it being contaminated. There's some other phytocannabinoids out there, some other different types of that are similar to marijuana and THC. Delta 8, which is can often be purchased in states that do not have THC legalized. It's weaker than Delta 9 THC. However, our animals tend to be a little bit more affected by it. Tetrahydrocannabidiol, THCP, that's kind of a newer one. It's stronger than Delta 9 THC, so we can have some significant effects with that too. This is just kind of a neat chart, nothing necessary to look at, but you can see what the clinical signs are. And we broke that down into CBD, synthetic cannabinoids, so like K2 or spice, and then marijuana. The marijuana signs are in orange, the synthetic cannabinoids are in blue, and then the CBD is in red. And you can see if you go down this list, and we just mentioned CBD really shouldn't show clinical signs if they're having issues, but you can see that these signs of like ataxia and vomiting and trembling and urinary incontinence is a very common clinical sign with THC. You could see that CBD exposures are causing those signs as well, really indicating that there's probably a lot of contamination between that. When we think about marijuana and THC with these animals being affected, their signs can persist for 12 to 72 hours. Fatality is pretty rare in most of these cases. However, they can be extremely sick. And we've had numerous calls with these guys that have gotten into a THC product that have had significantly low blood pressure, significant arrhythmias developing, hypothermia, or low body temperature that can't be controlled and regulated. So these guys can really become significantly ill. There's no reliable patient side test, unfortunately. So a lot of people will use the human urine drug tests, and those were designed, and they were calculated, or they were made for the metabolites in human urine. And so when animals actually have many different types of metabolites when they're metabolizing, especially marijuana and THC, and so they may test positive, they may test negative for that. And same thing goes with some of the other drugs. When we think about methamphetamine and ecstasy and some of these other cocaine, some of these other illicit drugs that have this urine drug testing available. And the reason why what I typically say is I don't waste my time with a urine drug test, because it's really indicated for humans. It's been validated on human urine and human metabolites. It hasn't been validated on animals. And so I'm really going to be treating them based on their signs. It isn't uncommon for us to get calls where the clinic has done a drug test and they said it's positive for methamphetamine, but their signs are not at all consistent. And we're going to treat them based on the signs, not what that test shows us. All right, so we move on a little bit to mouse and rat poison. So when we think about mouse and rat baits, as I mentioned earlier, we used to always think about anticoagulants that causing bleeding to occur and using vitamin K1 to treat these guys. But unfortunately, that isn't something that's the case anymore. We also have the other two main ones are going to be bromethalin and cholecalciferol. Bromethalin causes brain swelling to occur or cerebral edema. And so we see clinical signs with that of significant lethargy, ataxia, or difficulty walking. They can have paralysis, and they can have paresis, where they're just extremely limp and not being able to move well. Cholecalciferol again is the same as vitamin D3. And that causes excessive amounts of that causes high calcium to occur. And with high calcium, then we can get mineralization of tissues, and the kidneys are extremely sensitive to that. And so then we can see kidney failure developing from that. So here's just kind of a chart about kind of rodenticides through the years. And if you see that the anticoagulants are in that blue, the blue and then the orange as well, because they're divided into first and second generation, you can see, especially in that blue one, that really just covered the majority of what those rodenticides were until about 2015. And then in 2015, if you look at that gray line, bromethalin was really starting to be marketed over the few years before that, and really then started taking over as far as the top rodenticide or active ingredient in there. If you look at the bottom yellow line, that's cholecalciferol. And cholecalciferol has been marketed for agricultural use for many, many years, but wasn't really sold in for residential use. And then in 2018, the decon manufacturers, they started changing their active ingredient from an anticoagulant or a blood thinning product to cholecalciferol. And so cholecalciferol has really taken over as far as, or increased a lot in their amount that's there. All right, quiz for you. All rodenticides are color coded based on their active ingredients. Is that true or false? Anybody want to take a guess on whether or not rodenticides are color coded based on their active ingredient? Someone says true. Anybody else? I know I'm making you stand by a keyboard. It's not very fair of me. False. All right. So it's false. And it would be so great if it was true. You can see that there are different rodenticides will have different colors to them, different blocks of bait. So when someone says, my dog just got into a green block of bait, unfortunately, there's no magic ball that says this is what that active ingredient is. There are some companies that will color code within their company, but there is nothing universal for that. So some things to do with mouse and rat, excuse me, is to really keep that packaging if you can, and advise anybody who uses rodenticides around animals to keep that packaging. That way we can tell what that active ingredient is. Because as we just talked about, with all those anticoagulants, bromethalin, cholecalciferol, they all cause different clinical signs, which would only lead us to assume that they all have different treatments and needs, which is true. We want to use bait stations. So everything has to be sold with a bait station, but humans are humans and we don't have to follow the rules because we all know better than the manufacturer does and who needs that bait station. They're not proof, they're not animal proof by any means, but they certainly do help minimize the exposure to them. And then if you are going to use a bait, we say that, anticoagulant baits are usually the safest option because they have an antidote. And that's, it's true. However, really using something where maybe it's a live trap would be more efficient or effective. There are corn cellulose products out there that are fine, don't cause any issues with animals whatsoever. Although I haven't heard that they're really that effective with rodent control. And so people are typically going to start looking for something with a stronger active ingredient. Cholecalciferol has the most narrow margin of safety of all of them. So I am just not a fan of using any type of product with cholecalciferol with an animal around. I would say the same for bromethalin. They can get into a little bit more than what cholecalciferol is, but for our household, I would say if you have an animal outside and you're trying to control rodents, I would say let's use a cat and let them be your rodent control, or find those live traps so that you can avoid any type of bait altogether. All right, so moving on a little bit to how age affects toxin exposures. And this is really fun. And this is fun for any of you who work with animals at all, regardless of what it is, because I think it's important when we think about our young pets and we think about as our animals age, we see a difference in things that they get into. And I think that that's kind of interesting, because if you notice that when they're like a year younger, you could almost follow that top 10. And those are probably animals that tend to get into things a little bit more frequently, because they haven't learned any differently. They're still active, they're energetic, they're exploring a little bit more. But then as they get into that kind of that 2 to 5 year age, then things kind of shift a little bit. And then the 6 to 9 year age, we'll start to see some additional things coming in here. If you look at a year or less, acetaminophen is not in our top 10, but it's in our top 10 for a year and less. So that's been kind of interesting for that. But then if you look at the ages of like from that 2 to 5 year range, carprofen comes into the list. And while carprofen is in our top 10, we don't see it as frequently with those younger dogs. And so you can start to think about, well, maybe these guys they're more they're maybe more accident prone. They are maybe some of them are developing hip dysplasia at an early age, or some type of arthritis issue at an early age. But then if we look at it from the 6 to 9 year old age, these guys earlier, they were number 10, but carprofen moves up to number 7. So we're starting to get a little bit more problematic, a little bit more, illness or injury or arthritis or something like that. And then we get to the 10 to 15 year age, and then we start to see additional things. So we start to see more heart medication, because these animals will start to develop heart disease more commonly as they get older. So pimobendan or vetmedin comes into the list. And then we get to greater than 15 years of age, that Galliprant. So Galliprant is a non-steroidal that typically has a wider margin of safety. It's a little bit more expensive, so a lot of times it's not the first non-steroidal that gets put on the list of uses. But then as these animals have been using maybe a different non-steroidal for years, maybe they'll start to switch over to that Galliprant. And then we add, pimobendan, as we talked about, was number 10 for the 10 to 15 year old, but number 3 when they got greater than 15 year old. And so you think about these households that have different aged animals and what these animals can be exposed to. And so we start to see that shift a little bit more for human error, where they left chocolate and food and things like that out in those younger animals, to medications where they're getting into that were these pets, likely these pets' medication. A comment about ibuprofen. Ibuprofen is on our top 10 list. And something to remember is that cats are significantly more sensitive than dogs are. And with lower doses, we can see vomiting and stomach upset. We can also see stomach ulcers developing. And then with higher doses, we can see kidney failure develop in these guys. Ibuprofen is a really kind of a mainstay in many, many households. And so it's also one of, I think it was our number 3 toxin that we had, or maybe number 4. So when you think about that, I just threw in some medication tips. So some things to think about, either for you yourself or for any of your clients that you may have. Really talk to them about keeping their medications locked up and in a cabinet. So, does it have to be behind a lock and key? No, not necessarily, but should be behind a door. And so if we can not put it on the countertop, that would be ideal. If it can be up in a cabinet where the door is shut, where the animal really can't get into it. If you do have that cat that is a Houdini cat that can open up those doors and gets up on the counter and opens things up, then maybe you should have a lock on that, or certainly have it in a room that's constantly closed that the cat doesn't have access to. Make sure visitors and guests secure their medication. So it is not uncommon, or especially around the holidays, where we get calls where somebody was at someone's house visiting. They had their baggie of medication in the suitcase on the ground. They didn't think about the pet in the household, so they left their suitcase open, they left the room open, and the animal got in there and ingested the medication. Avoiding that baggie of pills if people can take their, I'm certainly guilty of it as well. I like to just throw my ibuprofen in a baggie if I'm traveling somewhere, so I don't have to take the container with me. But that can certainly be problematic, because it's easier for those animals to have access to that. I always recommend taking medications in a closed room to avoid those dropped pills. We get a lot of calls where the owner was taking the medication and they dropped it, and the dog or the cat just swooped in right below and grabbed it and ingested it before the owner could even get to it. or they sat it on the nightstand, or they sat it on a table, and they stepped away to get something to drink and came back and it was empty. It was gone. So I always recommend taking it in shut the door, take it in areas that the animal doesn't have any access to. That way, then if something gets dropped or is misplaced, then we don't have to worry about the animal getting into it. Also, never give any medication to a pet without first consulting a veterinarian. And a lot of people know a lot of things, but it's always really ideal to make sure you've consulted with a veterinarian, even if it's an animal approved product, because there are a lot of reasons why we don't want to give medications, or we change the amounts that are there between our animals, even if it's an animal product. All right, so I say enough about dogs. This is our cat Dorothea. She likes to sleep with her stuffed animal, but she also likes to be on high alert and just look cute. This is Tipper, and she is our 17-year-old cat who I think gets cuter with age, and she kind of has I think her ears have grown as she's gotten older. But we think about most frequently reported cat breeds. Obviously, I think we would all guess it's the domestic short hair. The domestic long hair, medium hair follows that. But we do get a few purebred cats that get into some things as well. Here's a question for you guys. The most common exposure call in cats is onions, lilies, which would be the Lilium species of lily, chocolate, or xylitol. Anybody want to throw in a guess? Lilies. Yeah, you got it. So it's the lilies. We'll talk about that a little bit. It's the Lilium species of lily. So we have a lot of plants with lily in the name, but so we're really concerned, which may have other concerns, but we're really concerned with those kidneys being affected with those liliums, and we'll get to that in just a minute. But chocolate comes in second, and it's about a 50% half less, so that's not so bad. That's still pretty good. Onions, garlic, those are all in the allium species, so they're in there kind of together. The vitamin D3, ibuprofen, Alstroemeria or Peruvian lily, which I think we're going to talk about here in just a minute too, amphetamine combos. Amphetamine combos didn't make the top 10 list, and they're not on the top 10 of dogs either. For some reason, cats love the taste, the smell and the taste of amphetamine combos. And then carprofen. While cats aren't given carprofen, it's not uncommon for them to ingest their pets, their dog mates, carprofen. And then tulips made it in that list. So renal toxic lilies, are they peace lilies, Asiatic lilies, Peruvian lilies, or all of the above? Which one would be a renal toxic, meaning a kidney toxic? It's going to cause damage to the kidneys. I see in all of the above. I see in all of the above. All right, this is why I love to talk about lilies. Asiatic lily. In this list, the only one is going to be of a Asiatic lily. And the peace lily it has lily in its name, but it's not in the Lilium species. It causes mouth and oral irritation. The Peruvian lily is it's Alstroemeria, so it's not in the Lilium species. And it looks a lot like a renal toxic or a kidney toxic lily, but it's very different in size. And we'll get to some pictures here in just a minute. But this is kind of a fun one. Another toxicology ECG for you. And so we get a big spike in lily calls Valentine's Day, at Easter, and Mother's Day. And they really fall pretty much exactly on those days. So when we talk about renal toxic or kidney toxic lilies, again, we're talking about those Lilium species. We're also talking about the Hemerocallis, which are daylilies. So the Lilium species is your Easter lily, your tiger lily, your Asiatic lily, stargazer, the rose lily that has become really popular over the last few years. And so those are ones that they may be in a fresh cut bouquet. They may be out in landscaping as well. All parts of the plant are toxic. So the pollen, the leaves, the stems, even the water from the vase that's there. So all of these things we can see stomach upset in cats. We can see stomach upset in dogs. But the biggest thing that we see is going to be the cats, where we can see kidney failure. Fortunately, we don't see an issue as far as that goes with dogs. And so dogs, if they get into it, are just going to have some stomach upset. These are some more examples of some lilium species, some different lilium plants or flowers. The bloom on the right is that rose lily. It looks a little bit different than the others. It has so many more petals to it. We always look at that middle puffy triangle. If you look at the picture on the left, you see that I call it the puffy triangle. It's the stigma that's there. That's really consistent with a lilium species of plant. And then you have the Easter lily. So come Easter time, we're going to have those Easter lilies out. The tiger lily is kind of neat. It's the lily that blooms facing downward as opposed to up. And then the oriental lily, which is a really common one to have in fresh cut bouquets all year round. So we can see some clinical signs of, the initial signs are usually within the first couple of hours. So gastroenteritis, so they're vomiting. That's a very common first sign to see. And then as we go into the next kind of 12 hours or so, these guys may become dehydrated, the PUPD. We may see some protein in the urine. We may see some casts in the urine as well. And then within about 24 to 96 hours, so 1 to 4 days, these guys will develop kidney failure. And so they will have a decrease in urine production, or even a stop of urine production altogether. These are some pictures that some pet owners, some pet parents sent us that their pet has gotten into, their cat had. You can see that on the left. A big chunk of that flower is missing. This one on the right, it's an awfully cute picture, but it really shows how pet parents don't often realize the severity of it and the concern of it. They took a picture of their cat next to the flower, and it's a really adorable picture, but it just really highlights the need to really start educating more and more cat owners as we can. We do have a campaign. It's called No Lilies for Kitties. You can go to noliliesforkitties.com. You can download flyers and newsletters and different infographics and things to help with your clients and your fellow loving pet parents. And there's also a list of some safer alternatives. There's pictures of the specific types of lilies that we want to get away from. As I mentioned earlier, not all lilies are renal toxins. So they are not all in that renal toxic or kidney toxic genus of Lilium or Hemerocallis. They can have lily in their name, and they can have a similar appearance for some of them, but they have other concerns. So the calla lily, which may be in some fresh cut bouquets, the peace lily, those two, as I mentioned, they're going to have more of a concern with oral and mouth, pain and irritation. That Peruvian lily, or the Alstroemeria, as you can see there, it has a lot of similarities to that renal toxic lily or that kidney toxic lily, but they're much smaller. They come in usually groups of 3 as opposed to 1 per stem. And then we have lily of the valley, which has heart concerns. So it's not that any of them are problematic. They have issues of their own. Fortunately, Peruvian lilies are just going to have stomach upset concerns. What about age effects for cats? So we look at that in the dogs. So when we think about, these 1-year-old and less, I point out that amphetamine combos are kind of at number 7. And why is that? Is it because the cats are, they're more agile, they're getting up onto the furniture a little bit more, up to the dressers or the countertops? And that certainly may be it as well. It also might be that the younger generations or younger people have younger cats. I think some of our senior citizens don't typically get a kitten. They maybe get an already adult animal. And some of the younger people are on a lot of different types of medications for their mental health. And so that may have a little bit more access to that. As they get to that 2 to 5 year range, it drops down just a little bit to that number 8 slot. And then it falls off in those animals that are kind of 6 to 9 years of age. But then we get carprofen in there. And again, carprofen isn't something that we give to cats, but when we think about, we have an older cat in the household, we probably maybe have an older dog in the household as well. And so it gives them more access to that. When we get to our 10 to 15-year-old cats, This is something where carprofen kind of goes up, again, probably because we have another pet, a dog that's more older, and so more frequently going to have access to that. A gabapentin. So gabapentin is a pain medication that often gets added to kind of the list of things when we have animals that have different types of pain with them. And so something we often see in older patients or older pets. And then methimazole or tapazole. So that's a treatment for hyperthyroid. So we think about those greater than 15-year-old cats. That's certainly hyperthyroid is something that we see more frequently in cats as a disease as they get older. And so then that comes into kind of that top 10 list for those animals of those age. And then gabapentin goes up a little bit more in frequency, again, probably just because of the more aged animals that are in that environment. Mirtazapine, it gets added to that. That's often used for an appetite stimulant. So something that maybe in our older cats, older geriatric cats, maybe our kidney failure cats that aren't eating very well. And then carprofen, again, stays in there with our animals. Next, I just want to point out toxin tales. I don't know if any of you have seen any of the stories that we've put out, but we put out a news release every month, and it's called Toxin Tales. And it's something that we started back in 2020. And it's been a ton of fun to do because we find stories that we've been able to help with pet poison helpline, either the pet parent or the veterinarian or both. And all these animals have a happy ending. So they survive. And so we're able to tell the story to help educate the pet loving community. And this is a fun one that I like to point out. This is a dog that she ingested moldy barbecue sauce. So the owner had cleaned out a crock pot of moldy barbecue, and they had cleaned it out in their yard, and they'd rinsed it out, and they just kind of left the remnants that were there, and sugar got into it. And unfortunately, it contained mycotoxins. And mycotoxins or tremorgenic mycotoxins can be in different moldy foods, and you can see it in compost piles as well. These things, unfortunately, they cause really significant neurologic signs to develop. So they may have some vomiting at the beginning, but they'll have tremors and ataxia or difficulty walking. They'll have seizures, they'll have hyperthermia or elevated body temperature. They can have a low blood sugar as well. Treating these guys, usually it's some type of decontamination if they're neurologically appropriate. You can give them some antiemetics or medication to stop the vomiting if they're having that. Intravenous fluids to help with just some stabilization and perfusion, and then medications for the tremors and seizures that they might have and monitoring their blood glucose. So fortunately, Sugar made a full recovery. And then there is Sawyer. And Sawyer's a fun one to talk about because Sawyer ingested some diaper rash cream. And normally we don't get too concerned with diaper rash cream. It's something that they typically vomit and they do okay. Most of it contains zinc oxide, but it's usually a concentration that causes stomach irritation. So they vomit, no big deal. Well, Sawyer got into this, called us, the owner called us, and we said, it shouldn't be a big issue. He's already vomited because he'd already vomited by the time he called. He should be okay. He might not, he might not feel the greatest through the day, might not eat as much, but he should be back to normal by tomorrow. And the pet parent called us back because he just wasn't feeling better the next day. And the next couple of days, he was just really frumpy and lethargic and not eating very well. And so we recommended he go to their veterinarian. He went to his veterinarian and they took a radiograph or an x-ray, and they found this clump of something in his stomach. And so they took him to surgery, and Sawyer had this big wad of hair ties. So this big wad of hair ties was removed, and the owner had said that, she loses hair ties every once in a while, but never a big amount. And so it's not something that she ever thought about. She's like, I just misplaced it, whatever. And so she would replace them. Well, Sawyer has been eating her hair ties for years and has been accumulating them in his stomach. And so what likely happened with him is then after surgery, he should have gotten better and felt really good. Well, he didn't. A few days later, he was still feeling really poor, and he started to become anemic. And with zinc poisoning, that is something that they can become anemic with and can be really life-threatening for them. So for this guy, what likely happened was that zinc oxide, that diaper rash cream, while he did vomit some of it, enough of it just kind of stuck to that clump of hair ties, and it stayed in the stomach long enough to become absorbed and to develop zinc poisoning. So he had a blood transfusion and fortunately did very well, but there were hundreds of hair ties in his stomach. All right. So as we wrap it up, I know we're 2 minutes from time here, but just really think about, be aware of the different toxin exposure fluctuations. So when we think about different times of the year, when we think about chocolate and we think about lilies and different plants that might be out there that are blooming or growing as well. Think about different types of medications, as when people are traveling, age-related changes as animals are aging in the household, and really think about your client education based on that. So when we think about, Poison Prevention Month is in March, and so we like to really highlight all, Poison Prevention Month. But it just as in practice, there's parvo season, there's allergy season, well, there's different toxin seasons as well. And so if we can educate pet parents, animals are animals, humans are humans. We're not going to prevent things from happening ever. But if we can educate them to at least recognize that when they do happen, to respond to it much more quickly, we can save a lot of lives that way. I just want to give a shout out to Dr. Amanda Poldowski. She's been with us for about 15 years, and she's our Associate Manager of Veterinary and Regulatory Affairs. She's integral in getting all this data together. And so all of those data charts and graphs you saw all came from her. So I just always like to give her a shout out. As we end up, I'm happy to answer questions. If you need RACE approval, so if you need RACE CE, if you're a veterinarian or a credentialed technician, please email me directly. I'm going to ask you to just jump through a little bit of a hoop. If you could email me directly with your name, your license number, and the state that license is in. If you have multiple licenses, I only want one. I only need one. And whether you're a veterinarian or a technician or nurse, I will get a RACE approved CE certificate sent over to you. So if you wouldn't mind doing that for me, I would greatly appreciate it. And I'm happy to answer any questions you guys may have.
That was amazing. That was really good. So many things that I got out of it. Like I said, I like being off screen so I can take my notes, right? Really appreciated that. I know, I think you addressed Madison's question about the bromethalin versus the anticoagulant. We kind of had that in there. I know that Stephanie had asked about whether or not xylitol is starting to show up on labels as birch sugar.
Yeah, so xylitol, they're getting sneaky, I think. So you can see birch sugar, birch extract. Sometimes it will say wood sugar. There's also like a polyphenol, and that doesn't necessarily mean xylitol, but it does mean it's a sugar alcohol, which is what xylitol is. There's a lot of different sugar alcohols out there, but it should be enough to pique your interest, to raise your eyes a little bit to see if that's going to be problematic. Fortunately, xylitol is the only sugar alcohol that's problematic. So when you see sorbitol, erythritol, maltitol, mannitol, all of those other ones, it isn't going to be problematic. Also, the sugar substitutes, so stevia, truvia, aspartame, all those different ones, we don't see issues with those either.
Okay, good to know. Another question here, nightshade plant.
Yeah, so nightshade is a tough one because it's definitely problematic. It's definitely problematic. We can see some significant issues with that, usually cardiovascular or heart issues, potentially some neurologic signs as well. And depending on the amount that they get into, depending on whether or not it's if they get into the berries, if they are ripe or if they're still green. So nightshades, all in all, the solanums of the nightshades, I would just say we want to avoid them if we can, as much as we can. But again, the dose makes the poison on those. So sometimes if they get a berry or two, probably isn't going to be too big of an issue. But I usually always play it safe with those guys and either do some type of decontamination or monitoring with them if they get into it.
Okay. Here's one curiosity, antifreeze. I did not hear you say anything about antifreeze.
Yeah, I didn't say anything about antifreeze. So antifreeze is definitely, fatal to most of these animals if they get into it. It's not in our top 10, fortunately, but we do certainly get a lot of calls on that for sure. And antifreeze is something that it can cause kidney failure. We have the same concern for dogs or cats or any other animal. And so it's something that if they ingest it, we can see kidney failure developing. There is an amount, again, the dose makes the poison. So sometimes if they take a small little lick, it might not be enough to be problematic, depending on the size of the animal. With antifreeze, you really have to treat them early on. And so with cats specifically, if you wait more than 3 or 4 hours to start treating a cat, it's usually too late. Dogs, you can go a few more hours after that, but if you're waiting for signs to develop, then it's too late. And that's been really, I think, one of the frustrating things or disheartening things with antifreeze and pet parents is they'll say, I don't know if he got into it or it's just a little bit. We're just going to wait and see how he does. And unfortunately, it's irreversible when they develop kidney failure. So it's something that a lot of times when these guys actually come into the veterinarian because they're in full kidney failure, it's not something that we can do to help them with. That isn't always the case with some of the other toxins that cause kidney damage. Sometimes we can have a certain amount of kidney damage developing that we can actually start treating and they can recover from. But when it comes to ethylene glycol or antifreeze, that's something that once they develop their signs and that kidney damage is there, it's going to be fatal to them, unfortunately.
Yeah, great question though, Sue. I'm glad you brought that
Yeah.
up. That was mysteriously missing, right? And here was just an interesting question earlier. Of course, drop your question if you have any others. I'm looking through these. This was just something Dr. Jen brought up at the beginning that had me curious. Do you have any comparisons of toxin trends between the US and maybe UK or any other countries that you know of?
Unfortunately, I don't. Our best one would be Canada, between the US and Canada, and they're really pretty similar, to be honest, between the US and Canada. The UK, we just don't get enough calls. There are some poison control centers in the UK that we could probably try to work with to see what their trends are, but that's not something that I have access to.
It's just kind of a curiosity, right?
Yeah.
They have some different things, but
Yeah, definitely different
exposures.
things and kind of different plants and different medications and different things like that. It would be interesting to know. I would be a little bit surprised if chocolate wasn't one of their top toxins as well, but maybe they're a little bit better at keeping things put up and out of reach.
Yeah, we're human.
Exactly. Yeah.
Their dogs are dogs too.
I know it. Yep.
Yeah, I know. I really loved in the presentation. You can tell, and I didn't catch her name before. That does the graphs and everything. Love the toxicology ECGs.
Yeah. Isn't that
visual
so fun?
representation.
Yeah, she started sending me some of those trends, and I'm like, this is just, I have to use these a lot. And I took the 4th of July one out because I was afraid of time, and I should have left it in. But so I did one with 4th of July where we actually had 3, and we compared firework exposures, trazodone, which is a sedative that gets often used for separation anxiety or anxiety in pets, and then calming chews that they often have like tryptophan in it to try and help calm them down. And you see this huge spike right on the July 3rd and July 4th. You see it on all 3 of them. You see this huge spike, and then you see the spike again on December 31st. So on New Year's Eve. You see it with that. That's a fun one too.
And I can say around social media, I'm seeing it everywhere. Today's the day to call your doctor for your trazodone prescription for the 4th of July. So
yeah, do not wait till July 3rd. For sure.
Wonderful. This has been amazing. Any other questions? I know there's usually about a 20-second delay, but I want to make sure we do not miss any questions from our audience. Of course, I love this Sawyer story. Still a good boy.
Yeah.
Poor Sawyer.
And then we had another one, and I didn't put it on this one, but We had another one where the dog ate the owner's Fitbit, and the owner had lost her Fitbit, so she wasn't sure what had happened to it. She has 2 dogs in the house. I think they were both golden retrievers, if I remember right. And her app on her phone was continuing to track. It was continuing to show that the Fitbit was moving. And so she decided to take the dogs to see, well, maybe one of them ingested it. So she decided to take the dogs for like a walk one at a time to see which one was still tracking. And so she found the one that was still tracking. And now I apologize, I can't remember what her name was, but she ended up having surgery, and they removed the Fitbit. And they also removed a rock that was just an incidental finding in the stomach. And fortunately, that Fitbit, the concern becomes when they have batteries, anything with batteries in them can be really tissue damaging if they're ingested. And so fortunately with this one, that it was still in that kind of plasticky, rubbery encasement. And so she didn't have any concerns as far as that goes. But that was a fun one too for her getting into the Fitbit.
I can't imagine the stories that you've seen. Oh my goodness. So wonderful. I thank you so much. I know we have run over time, but this has been extremely helpful. I know I will be sharing this with clients across the board. This will be amazing. I did want to share just a little bit. Of course, Dr. Jen the vet has helped us get these amazing kind of dual pack webinars for you to help with the education. And I just wanted to share this link to one of the things that she, of course, has available. If you are a pet care facility who's really committed to keeping pets safe and healthy from infectious diseases, you might want to go to her Healthy Pet Keeping Seal on her website and take a little look at that. So very thankful to her for helping us out here, getting it coordinated. And then finally, of course, for those of you that are in the PAC, here is your PACCC code for attending this evening. Any other questions? Just looking over here, this has been huge, such a large amount of value. I appreciate you coming on. You've given me a lot to share myself and a lot of notes to go over.
So. You bet. You're welcome. Well, thanks for having me. And thank you to all of you in the PAC. I was exposed to PAC a few years ago with the IBPSA conference, and so impressed with the dedication that you guys have to just animal well-being and just the life of pets. And pets have never been just an animal in my household. They've always been family members. And so it's so great to see such a dedicated group of people who believe in that same value in animals too.
Yeah, we really have a rock star group of volunteers that put so much heart into this to get the word out. So appreciate you for acknowledging that. Wonderful. I guess we will end for the evening. I appreciate it. Thank you guys for attending. And we hopefully will have something else coming new to you soon. Thank you.
Bye.
Bye-bye.